serious. Therapists of Reddit, what do you do if you think your client is just generally a bad person? Maybe it's my personal view or my professional training or both, but I've met some incredibly malicious seeming people, but could never believe them to be bad or evil. When you speak to these people, they have fantastic justification and persuasion skills. They really believe they're not in the wrong. How can you see someone so lost and out of touch with reality as evil? There is always a thought process, incident, or underlying truth behind all the evil thoughts I've encountered in others. On the other hand, a client that is painfully annoying or I just can't get through to, I refer them to another therapist. Lol. Emo. Those types don't seek help. If they are there in your office, they are trying to honestly understand their problem and maybe even change. Out of the hundreds of patients I have seen in my 15-year career as a therapist, there have been only a handful of people I could not connect with and had to transfer to a coworker. These were without exceptions mothers who'd mistreat their children without regret or willingness to reflect on it. I was not the right therapist for them. For all the others, I'd find a way, an angle, anything. Be it the t-shirt they were wearing or the smile when they were talking about their pet snake or anything at all really to start connecting. No matter how boring or aggressive or adapted someone presents themselves, there is always someone deserving of love and recognition underneath it. Luckily I've never encountered this with any of my clients. However, if this ever does occur in the future, I would most likely like to keep treating them, maybe find some insight of what happened to that person. Family history. Get an understanding of is this person a product of their environment or genetics? Possible both. But the moment I actually stop having the need to help that person, or if I feel they are trying to control the session or manipulate me, I would have to refer them to someone else. I honestly didn't buy into the theory of this at the beginning of my training, but now I really do. If ever my own judgments come in when working with a client, I have to remind myself that the client is being the best person they can be within their current experiences and conditions. Accepting the client for who they are in front of you and not only seeing them for what they've done and pushing aside your prejudice is hard but worthwhile for me and my clients. It doesn't mean I have to like a client on a personal level. Just accept them for who they are and give them the space to grow. I don't feel the need to change them with my own views. Value the person always. That doesn't mean you have to like them. If they have personality disorders, it is probably prudent to signpost them for DBT rather than keep them in person-centered counseling as a singular therapy. However, if it's just a case of them not fitting in with your own personal values, then the therapist needs to reflect on this themselves. What is it about this person I find so difficult? What has happened with me? Why I have this reaction, etc. Also, for congruence, it is important that you are tactfully honest about your feelings. There is room for this in a therapeutic setting. A question is now, why was this posted by the op? Are you having a hard time with someone? Are you a client that does not feel supported? Let us know and we may even be able to help. Edit. Apparently I have been told that replying to comments means the person answered may not see the answer. I will always endeavor to answer any messages. I'm new here, so I'm still learning. We have a saying in narrative therapy, the problem is the problem. The person is not the problem. This statement helps me see my clients more empathically and non-judgmentally. We try to see clients holistically, with the recognition that even bad behaviors or patterns are coming from somewhere. We don't assign good or bad labels, but we focus on the roots of these behaviors, patterns. Understanding a person's context is so important, as is dissecting the reasoning and motivation behind the behavior. Personality disorders are much harder to dissect and understand. People diagnosed with a cluster B issues especially are more likely to be labeled. It's important to be conscious of this tendency and recognize that at the end of the day, if they're sitting in your office saying I need help or I want to change, then there's something there, and everyone has that something. I am still human though, and if I find myself judging a client or getting triggered or experiencing negative feelings towards them, I seek supervision and try to understand the parts of me that feel this way. When the parts of me communicate, therapy flows much smoother. Another commenter already said so, but I would also want to ask you OP, if you have had any personal experiences relating to this question, as a client or professional, please let us know so that we can help. I work with a population that is considered by most to be made up of bad people, sexually violent predators. I believe that you as a person are defined by more than your past mistakes. Due to that belief, I am able to treat all of my clients with respect and hope for the best in terms of rehabilitation. I don't work in mental health anymore. Changed careers because of health issues. But the only person I ever dealt with who I knew was a truly antisocial and dangerous individual was an adult male I assessed for the court while he was in jail for trying to kill an ex of his. He was chilling. I worked exclusively with clients involved with some aspect of the justice system, and most of the time, they were suffering from generational poverty and trauma, and it felt enormously rewarding to help them. This particular individual was truly beyond help, however, and was a danger to others on a level so severe that multiple people involved in the case were actually afraid to go to hearings for him because they thought he might try and kill them. I mean the professionals involved, not victims of his. It was the only time I recommend against services because it was abundantly clear he would use whatever means he could to get out of jail and try and murder again. I didn't trust that a service provider couldn't be manipulated by him or even be at risk of getting hurt from trying to work with him. It was a scary 4 hours of my life. I'm currently studying to be a social worker, and a concept we learn is called facilitated genuineness, which translates to essentially treating every single person who walks through your door the same as you would any other person. Doesn't mean you can agree or like the person they are or the actions they have made, but it's a duty as our job to treat and help anyone no different from one another. Unless I'm extreme cases like if you literally cannot keep it professional and you just ducking hate the person you just asked to not be their worker anymore, that's different from a therapist out, almost the same deal. Never be scared. There are 3 things a counselor should provide you with: congruence, honesty, empathy, seeing your issues from within your frame of reference, and unconditional positive regard. You will be held and supported. Most people will go through a period of psychological or emotional distress. It's almost inevitable. Nothing you say will shock or surprise your therapist. And I can totally agree with your fears. I was scared to seek therapy because I felt like I'd be locked up. It was the best thing I ever did, and it set me on this path to help others. Trick question: who is considered a bad person? If you ask most people why they did something, they usually have reasons explaining why. If you're talking about sociopaths, psychopaths, and personality disorders, unless you work in a prison or a sex offender program, etc., you will most likely not come across many OSABud people. With all clients I generally align with them, meaning I strive to see things from their perspective, which isn't generally hard because most people are basically good and are doing the best they know how and simply want to be heard and understood. Everyone gets the spiel about confidentiality and mandated reporting, which means if we believe they or someone is at risk that we must report it. Other than that, it's their time to be heard. Everyone has their own lens and reality which they've been seeing the world through, even with those who have personality disorders, and who often take very little responsibility, if any, in their relationships. It's easier to keep in mind that frequently their childhood and upbringing led them to their current presentation. So, even if they're engaging in crappy behavior, you can still empathize with them and have compassion. Not sure what other scenarios you might be alluding to. If they're unpleasant in session, like towards the therapist, often it's projection. Anything that is brought up is almost always an opportunity to re-examine it, both for the therapist and the client. The main thing I've had to watch for is super sneaky manipulation, which you often realize after the fact, but I'm getting better. We do our own work as well. Tell them, what's the point of keeping it a secret? 2% of the population are actual psychopaths, and whilst many psychopaths are nice people, there's a cluster of antisocial personality types, and if your client belongs to one of those groups, they won't be able to manage their own behavior unless they understand it. I also talk to the family, without breaking confidences, because it lifts an enormous burden if they can understand the pattern of behavior. Most clients are bad people to someone. Some are just considered bad to more than others. You would be shocked at how much damage people are carrying around with them and the things they have had to do in order to cope with it. A good therapist will leave their own BS and judgments at the door and find a way to put themselves where the client is so they can figure out how to navigate that maze properly and without being alone. I am currently working with almost exclusively conduct disorder teenagers that have been in gangs and went to juvenile hall. Some of them have shot people. Most are on drugs. And all are hated by at least a few people. You can tell there's a good person somewhere in each of them, but they feel like there's no turning back from the life they've chosen. They need someone to believe in them and help them bring out that good person again. Telling an awful person that they're awful only makes the problem worse. I always try to look for something in my clients that I enjoy. I also ask myself, what experiences has this person had that has contributed to who they are today? What is the purpose for this behavior? Usually it is the behaviors that people find off-putting rather than people themselves, but we get caught up in labels of bad good. That people judge the whole person based off of one action or a small amount of time spent with that person. Remaining open-minded helps me separate the person from their behaviors. Every client that I work with I am honest and transparent with from the beginning and explain the importance of the therapeutic relationship. If they don't like me, feel that I am a good fit for them, then please tell me. That way I can refer to someone who I think would be helpful. However, that goes both ways. If I feel that I am not being helpful good fit, I will talk to my clients about it and potentially refer out. Retired psychiatrist here. I had to frequently remind myself that my duty was to try to relieve suffering, not to pass judgment. Now, of course, when I was working with people with personality disorders, read, people who habitually annoy or harm other people, it was my duty to point out and explore their harmful behavior in order to decrease, over time, their own suffering, as well as that of people around them. This frequently involved setting limits within therapy, pushing them to learn how to behave with a person who did not submit to their manipulations. It's important to note that, if you are not a therapist, you have no obligation to try to correct the behavior of disordered people. Your first duty is to protect yourself by setting limits and sticking to them. In over 15 years of counseling, I have yet to meet someone who is an awesome person. There are people who have awesome behaviors or actions, but once they let you in underneath the bravado and the hard outer shell, I generally find a very hurt person. If I have a negative reaction to a client, I have to take a step back and self-reflect. What are they triggering in me and how can I resolve that to be there in the way they need to find some healing? I find that being in the position I am and having people allow me into their inner world has led me to being more understanding in my personal life as well. I always try to picture people at their purest before anything untoward has happened to them. People are not bad. People engage in bad behaviors or poor decisions, which can negatively impact their lives and those around them. If they are seeing me, I am there to assist them in making changes to how they think and act. Hopefully, they are a willing participant in this process and want to make these changes. I have spent a portion of my career working in the prison system and met men who did very bad things. I always found it helpful for me to picture the person being a small child and trying to see what they would have looked like at the age of 5. Once I could find this, it was easier for me to understand how the individual arrived at this point in his life. We are the sum of our experience. I have also spent a portion of my career in an outpatient mental health clinic. I currently have a patient who is a 50-something female who spouts off the most disgusting, racist, and offensive things regarding society. Every time I see her in my schedule, I cringe, and she is in front of me, though. I try to see past her words and understand the fear she has about life and the reasons for it. I might not agree with most of her societal views, but I understand why she has them. As long as they don't treat me that way, I like to keep it to the subject that they came to me for. Hopefully afterwards any bad behavior also decreases. But if it is not part of the problem or illegal, it is not up to me to change a person against their will. I would give them a lecture every time for a bad decision they might not want to show up the next time. Thankfully it is not something you run into a lot. Once had a client that was seriously the meanest person I have ever met in my life. She tried to manipulate everyone into feeling sorry for her, and when they didn't, she would verbally and emotionally attack them. She drove me to tears several times, and I have been doing this work for a while. She was incredibly mentally ill and paranoid that people were coming into her home and trying to mess with her just to drive her to a nervous breakdown. She accused me of using Bluetooth from my phone to steal information from her phone. She would play vicious mind games and report she was just testing my ability. Eventually it became too much for me and I explained I would need to refer her to another professional. She lashed out and told me I was weak and never did her any good anyways. I ended up having to put her in the hospital because her delusions got so bad I thought she was going to hurt herself. When at the hospital they discovered she had a mass on her lung and determined it was cancer. I ran into her once after she left my services and she spoke to me like I was trash. She passed away in November. I know this is horrible, but I was so relieved. She is finally at peace and not fighting crazy delusions and paranoia every day. And she is not terrorizing people around her. I honestly can't say how much of her behavior was due to her mental illness, because even on her best days she was still the most horrible person I have ever met in my life. Use unconditional positive regard and NCBT techniques to teach them how to see from different perspectives. They may not truly ever learn empathy, but being able to understand the effect they have in others is a great step. From there is about validating their progress, so they feel rewarded for this new behavior, and reinforcing it. It's a slow process for sure. I don't think there has ever been a time when I thought a client was a bad person. I have thought other things about people, but I believe that we all live with context around us, a majority of the time. As a therapist, you get to learn that context, and the context is what keeps me from thinking people are bad. Everyone has a story. For most, if not all, therapy's a core component is often to remain non-judgmental and to seek a shared understanding of the problem a patient is presenting with. I don't think I've ever thought someone I was working with who I thought was a bad person, because you learn that it is usually more complex than that. If they have done bad things, there is often a broader context. Now that isn't to say I haven't had reactions to patients, such as feeling angry, frustrated, disgusted or scared of them. I spoke to a colleague who worked in forensic mental health years ago, and while they were talking about their work they referred to their patient group as not nice people. Bear in mind, these are patients who while mentally unwell have done some very shocking, sometimes fatal things to others. Even after all of that, the judgment made is not nice. I would say it is way more common that patients are concerned that they are bad people. It is really common across all problems. But I would guess that obsessive compulsive disorder is probably the one which worries people the most, and that is because the intrusive thoughts they are getting are often abhorrent to them, or the technical term ego-dystonic. If you're asking for yourself or a friend and building to courage to seek therapy, my recommendation would be to do some research on the most effective type of therapy for what you think the problem is, then seek out the lead accreditation authority and use their Find a Therapist search through their website. That is the best way to find a component, reflective and well-trained practitioner. This is a wonderful question. Always respect your client and be patient learning to understand them. I work under the premise that all behavior makes sense. I remind myself of this daily. Any behavior, positive or negative, serves a purpose. Most negative behavior is a soldier or way the client protected themselves at some point in the past and are struggling to see that they no longer need that soldier or that it can adjust to a new stage of life. I work primarily with child in therapy through directive and non-directive play. Charlie Pleshin has a wonderful book, There's No Such Thing as a Bad Child. I believe this with my whole heart. Children are a product of their environment and many of their skills they have developed to survive. If I do start to become overly frustrated with a child's behavior and lack the compassion that I mentioned above, then I need to reevaluate how I'm working with the child. What am I not seeing? What other techniques or approaches should I explore? Also, I need to evaluate myself. What from my personal life is influencing my work? Freud called this transference or countertransference. This is typically a call to my therapist to explore on a deeper level. If it's not something I can work through, then I talk to the client and or parent about referring out. I know it's been asked, but I also wonder if you feel like a bad person and that your relationship with your therapist is struggling, or are you struggling in your profession? Either way, it sounds like there needs to be some exploring. I'm a therapist with children, a lot of whom are really aggressive or labeled emotionally disturbed. It's always crazy working with a kid who other parents label as evil or psycho. But I usually think about the fact that if I don't help out this person, no one is going to, and that's really dangerous for themselves and anyone in their lives. I was taught in school to act as if the person I was evaluating was, say, a pedophile, or even Hitler in one classroom experience. I remember being told specifically that if you couldn't sit in front of that person and separate the issues from the person, you were in the wrong field, or at minimum would have to refer that person to someone else. We spent a lot of time talking about the aspects of what makes a person in general, like touching on their interests and hobbies, and that even the best of us have really bad days, like the day they shot up a school or something. There is a person underneath the action they perform to require therapy. I have moved away from my interest in doing one-on-one counseling, but I think that perspective helps me in all day-to-day interactions. They are very rare, but I can tell you from experience that there are some purely evil people in the world. When you meet one, it's very disturbing. Your brain almost refuses to process what it's picking up. You can literally feel malevolence rolling from them in waves. Most of them are in supermax prisons. Don't visit them. Basically, trying to stay in contact. In my work in prison, I have to and am ready to see them regularly, as long as they are willing to do so. And I am willing to bear this, since I am offering the lowest bar to pass to have a therapeutic interaction. It is not easy at sometimes, but I always make myself aware of my own impressions. I happen to come across some bad persons, demonstrated by the acts they committed to be there in the first place. I am behaving fair. I do not try to force them change anything. I do not tell them what to do. I do not engage in provocations they try to instill, and sometimes the ice breaks. My experience is that it sometimes just takes time to get to build some trust, and then a person who seemed to be all but dissocial personality disorder suddenly shows their complexity. It often boils down to needs and desires and the means to obtain them. They are not bad because they just are. They are because they are overburdened and pushed to their specific limits. Some people have only a very limited, and hurtful to others, way of getting what they want. So I stay in contact and let them get to the point of what they want. And we seek for ways that are not based on another person's plight. The inherent bad are very few. The ones who are just needing something and don't know a social amicable way to get it are many. I work with children at a psychiatric day treatment center, and sometimes it is extremely hard to not feel anger towards the parents. There have been clients where the clinical team has described wanting to beat their parents with a brick for what they've done to the child who is now in our care. When that happens, we need to pull back and refocus. It's important to remember that we don't know what happened to the parents that caused them to do this. It's not always easy, but it keeps us sane. I've found many therapists usually have their own issues just like everybody else. Usually more. Hence that's why they found the field so interesting. But that also makes them prime candidates to help others. Bad people, those truly evil, are rare. And when you find them, the best thing you can do is teach them control. And the fact that evil makes them end up in prison. So suggest outlets so they don't get tempted. I can honestly say that I've never had a client I thought was a bad person. Every client who is coming to me in a place of trying to change and better themselves. And by coming to me, I have a great opportunity to influence positive change. Why ruin that by souring the therapeutic relationship I spent so long trying to build by thinking I know better and judging them? And note that when I say positive change, it's the positive change that a client seeks in their own life. It's step by step. I hold tight to the idea that if I had been born with their genes and had their experiences, I would be acting the exact same way. There's a saying that rolls around in therapeutic circles that hurt people. Hurt people. If someone is acting bad, they've almost definitely been treated badly. If I'm reacting to them negatively and they're rubbing me the wrong way, then I am definitely not the only person that has had that experience with them. And that sucks for them, right? The sweetest things in life come from being vulnerable and intimate and loving with other human beings, and bad people tend to have a hard time doing that. I wouldn't change places for the world. So I try to lean in hard to compassion. All that being said, part of effective therapy is helping people learn to take responsibility for all that they're carrying around. Whatever childhood trauma, poor coping skills, anger, addiction that any of us have is not our fault, but it's still ours to deal with maturely and kindly, whether or not we deserve it. Thanks for the question. BTW equals. First of all, I almost never make moral judgments. It's bad practice both personally and professionally. Like, what do you gain from evaluating a person as bad? Almost always it's nothing constructive. Second, I generally don't care even if I do. I just watch out for third parties getting hurt. But hey, it's not my job to like my clients, just to help them. That doesn't mean that I take every client. I may choose to accept or canalize people that ask for psych services from me, but rejecting them because I don't like someone, bad way to deal with almost anything in my life. If they trigger something in me, the most likely reason for me to not like them. That's my problem, not theirs. Am I competent enough to leave that aside in this particular issue? I hope it is. If it's not, then I should leave that client with someone else and work on it. I don't like typical professional mannerisms, but they are very useful in these situations. I've never found someone that has absolutely no redeeming qualities. I've had awful people that do terrible things, but there's always something good about them. I think the point of therapy is to bring out more of that good and minimize the bad. Similarly, to be a therapist, you have to be able to look past the bad and dig for the good. The only bad person I could think of trying to help would be someone so lost in malicious delusions. They do not recognize reality from their psychosis. Even this, however, is just a person lost in their own mind. Not evil or bad. I try to give each person the help they need most. This just changed drastically from person to person. Different people will have different goals. As therapists will have or help people achieve different goals. After a time, I find a way to tell them they know right from wrong, and until they start making better decisions, their life won't improve. If they won't, I will dismiss or refer them. That dismissal will sometimes bring them around. If not, I continue to work with others I can help. Are they bad because of nature and or nurture? People make decisions based on brain chemistry and life experiences, both of which are outside of their control. I think everyone, and I mean everyone, is doing their best with what they have in life. For some, it's just easier to see that than others. In my opinion, we can't judge anyone deep down inside. Also, I think many people find it easier to judge and ridicule someone than to try and truly understand them. It is not my job to like my clients. It is my job to value them, empower them, and provide them a safe and non-judgmental place while promoting healing and recovery. However, I have learned throughout the years that even people I don't like have qualities I admire. It is not as black and white as I like them or I don't. People are beautiful and complex.